Hi, I'm Steve Adubato. This is One on One. We're pleased to welcome once again Dennis G. Wilson, President and Chief Executive Officer, Delta Dental of New Jersey. Good to see you, Dennis.
Good to see you. Great to be here.
So much going on in the area of oral health. We've been talking about this subject for the last year or so, trying to educate folks. By the way, when it comes to oral health, why is this such an important topic for New Jerseyans and others to know more about?
Well, I think oral health has been sort of underestimated over time. And it's become just clear and apparent that oral health and systemic medical health are married, really. They're one and the same. The body includes the mouth and the oral cavity. So it's just part of us. It's connected to so many other things, disease states, anomalies, that sort of thing.
Let's talk about the future of healthcare leadership. You've told our producers that it is critical that the future of healthcare leadership be understood by everybody. What does that really mean?
Well, the future of healthcare, when I talk about the future, I talk about transformation. And that's transformation of a historically maybe disparate system where there are just pieces and parts, some knitted together, some not. The future is about real consolidation. Clinically, healthcare organizations are getting larger, more diversified, and so forth. So when I talk about the future, I talk about a bigger umbrella with several components under it.
Okay, let's break that down a little bit. So people who know our series know that, say we've had one hospital underwriter and then another, and all of a sudden they become one. Right. Right, or they just, it doesn't have to do with us, it could be any hospital or hospital system. Is it a simple question of whether it's good or bad for healthcare consumers, or is it a question of needing to understand what impact it has on us? And how do we even find that out?
I think it's the latter. I think it's all about the impact. You know, it's no secret that competition raises the bar. And we are very, very fortunate, I think, to be in New Jersey, to really have excellent healthcare systems here, not only in the state, but surrounding the state. So we are an attractor of the best and the brightest, no question about that. And it's all about the outcomes. It's all about getting people better, preventing diseases, managing diseases better. And when resources combined and the more consolidation we get, in my opinion, I think it's better off for ultimately the patient, who is why we're all here.
Now, you talk about patient-centered care. And there's a lot of rhetoric around the Affordable Care Act. There's a lot of confusion about the Affordable Care Act, and we're doing this in the fall of 2016, and we have no interest in talking about the presidential race. It'll be decided. This will be seen after.
Sure.
But the bigger question is this. When it comes to the ACA, Obamacare,
right,
what do you believe the real impact has been in terms of oral health?
When we talk about patient-centered medical home or coordination of care or things of that sort, you're really talking about the whole patient. And you're really talking about managing the particular disease states or propensities that a patient might have relative to their overall health, not just oral health, not just systemic medical health, but the whole patient. So when I think about patient-centered medical home, I really think of it more as a neighborhood versus a home.
What do you mean, a neighborhood? Break that down.
I'll give you an example of that. So a patient has cancer, is undergoing oncological treatment. That patient has a universe of providers in order to help he or she get well. And one of those providers is the dentist, because when someone's going through radiation therapy, as an example, their oral cavity there's a war in there. There's absolutely things going on that do not normally go on under other circumstances. So the treatment is unique, the treatment is special and specific to that patient. Therefore, that oral health provider, that dentist, is now part of that medical neighborhood.
And so therefore the ACA in that way has created more opportunities to help that patient that may not have existed before?
I believe that. I believe the ACA was an accelerant to having that happen. How the ACA changes, whether it will survive, is a matter for another time.
Question.
It's a
But
political
from a healthcare
question.
perspective.
From a healthcare perspective, that piece will survive.
Okay, let's talk dental scholarship. Scholarships to those who are pursuing a career in oral health dentistry. Talk about that and connection with the organization.
Sure. We have a foundation called the Delta Dental New Jersey Foundation. It's been standing up for 30 years now. And collectively, we've given nearly $20 million to various initiatives all around oral health for those that do not have access, for education purposes, for the treatment of children and seniors. A component of that education is the granting of scholarships to dental hygienists.
Dental hygienists?
Dental hygienists.
Okay.
Yeah, absolutely. So we feel in New Jersey that dental hygienist is an extension of the dentist, a critical portion of the dental office. And we feel to have great hygienists, you just have great dental practices. So we're all behind that.
So interesting with the foundation. And by the way, to fully disclose, the Delta Dental New Jersey is one of the supporters of what we do in public broadcasting.
Yes.
Largely around education around oral health. But why do you feel like that's the responsibility of your organization to have such a foundation?
We're a not-for-profit.
You're a not-for-profit.
We are a not-for-profit. And we feel with that we have a responsibility. It's ingrained in our mission to be socially responsible and to be focused on the oral health needs of those that do not have access or do not have the means.
And finally, this van.
Yes.
Talk about the van that we've seen sometimes in some video we've shown in the past. What is this van? Where does it go, and who does it serve?
We're very proud of the van. We have
It's the Delta Dental van.
We have a partner in that, the Zufall Health Clinic, which is a federally qualified health center.
Great organization.
Great organization. And across 5 counties, our foundation has, over time, helped build that van, had financed the building of it. And it is literally a rolling dentist office. It's a full operatory. And it will go to where the patients are. Those that have issues with transportation, access, or do not have the means to get dental care through insurance or any other means.
Going to where people need it.
Going to where people need it.
Dennis G. Wilson, President and CEO, Delta Dental of New Jersey. Continue to talk about oral health, and which is a topic not covered enough, not understood enough. Thank you so much, Dennis.
Thank you, Steve.
Appreciate everything you do. Stay with us. We'll be right back right after this.